One concern that we sometimes hear from people contacting us, our helpline, is that they're worried that during the course of treatment, they will become increasingly ill. Is that fair? Can people expect that? Or sometimes during treatment, will the symptoms that they've had when they found out they had lung cancer get better?
It's really important to make sure that if you're having treatment for lung cancer, that the treatment is helpful and you can tolerate it, that you are benefiting from it. Clearly, if you are having a treatment which is to get rid of the cancer completely and hopefully cure it, you might be more willing to go through things which side effects which might be unpleasant, but at the end of the day, you're looking to be cured of the cancer completely. But even in those situations, it's important that any treatment that we offer someone is done as safely and with as few side effects as possible. However, in treatment where it is not possible to cure the cancer, it's really, really important to have a good discussion with your lung cancer team to make sure that the treatment is doing good. Now, doing good can be measured in many different ways, but I think it's important, first of all, to make sure that the treatment, the side effects, are not worse than the condition. And so if you're getting significant side effects, it's really important to discuss them with your lung cancer team, because they may be able to make alterations or changes to your treatment that will decrease those side effects. It's also important when you're having the treatment that any symptoms that you might have are getting better. And that's a really essential part, that you need to be feeling better as a result of your treatment. So if you've got a bad cough or a bad pain, that cough or pain is improving as a result of the treatment. And finally, as part of monitoring the treatment, you will almost certainly have tests such as blood tests and scans to see if the cancer is shrinking or hopefully getting less of a problem.
So when someone is on treatment, how will their medical team be able to tell if the treatment is working?
So if we want to make sure the treatment is working, it's important that your team assess you regularly. Now, that might be face-to-face, or it might be over the phone or by video, to see how you are, and also monitor your treatment with blood tests, but also have regular scans to see whether the treatment is working or not.
If someone is concerned about the treatment that they're being offered, can they ask for a second opinion?
Yes, I think anyone is entitled to a second opinion. If you feel that you want to have a second opinion, you can certainly ask for one, and I'm sure that any lung cancer team would be very pleased to organise that for you. It may take a number of different forms. It may be, again, after discussion with you, it may be within the same department or team, or you may wish to get another team in another hospital or another part of the country to give you an opinion. I think in most cases, my experience is that the treatment that people are offered is, generally speaking, good treatment, and is generally the same, and most second opinions are the same as a first opinion. Very occasionally there is a difference, and it's important that someone understands why people have come to different opinions and what the different options might be. So I think it's very important that you can have a second opinion, but I think you have to understand that many opinions might not change, and if they do change, what treatment do you think is best for you at the end of the day?
And can you tell us a bit about who is involved in considering what might be the best treatment that are offered to people with lung cancer? I think we've sometimes heard the term multidisciplinary team. So what does that mean in terms of treatment decisions?
it's not just one person deciding what treatment is best for you. It's actually done by a number of different people, of specialists who all gather together, usually at least once a week, sometimes more, and discuss particular cases, the results of all the tests and the biopsies. And through a group discussion and reviewing all of those tests, together with other factors that you may have discussed with a lung cancer nurse, for instance, that a treatment is put together for you by the MDT, and they are very experienced in working out what the best treatment might be. And so it's not just one person's thinking, one person's opinion, if you like. It is usually a collective decision of the MDT in working out what the best treatment or treatments, and if there are more than one option for treatment, that should be discussed with you, and you given the pros and cons of each treatment so that you can decide which is the right one for you.
Is treatment for lung cancer improving, and is there new research that makes treatment more effective?
So the treatments available for lung cancer now in the 21st century have really exploded in terms of the number and types of treatment that are available. We know that there are advances in treatment across all types and stages of lung cancer. And those advances have come about through research and clinical trials. And it's usually not one big advance, it's usually lots of little advances which over a period of time do make significant differences. And so we're seeing more people being offered surgery and the results of surgery coming through. We're seeing more treatments that are being used in terms of controlling the disease, to control the disease for longer and with much less in the way of side effects. And all of those treatments have been developed through research, both nationally and internationally, and that continues to be the case. And it really is a very, very rapidly changing field and a rapidly developing field.